When an OEM comes to us after a field action, the conversation almost never starts with the actual root cause. It starts with the headline. A director of quality slides an FDA recall notice across the table and says some version of, "We can't have this happen again." The Abiomed Impella recalls are useful because they are in the public record, and they span several distinct failure types. I have onboarded enough OEMs recovering from field actions to know which of these an assembly gate is supposed to catch, and which are a different problem entirely. LSO runs cleanroom assembly, kitting, and packaging validation for OEMs who cannot afford a field action. Here is what that footprint looks like. Start by separating the events. The 14 French introducer kits were recalled for thrombus and leak concerns. Some Impella CP with Smart Assist units did not meet design specifications, and the left-sided pump family got an instructions for use correction for perforation risk. Here is the first thing I tell OEMs who lump all 4 events together. The perforation action was fixed with labeling. No leak test station or bond integrity gate would have touched it. Match the control to the failure mode, or you will pour investment into the wrong place. The introducer leak and the out-of-spec Smart Assist units are the ones that belong in an assembly gate conversation. An introducer sheath and its hemostasis valve are a bonded, sealed assembly. You cannot confirm that joint by looking at it, which makes it a special process under ISO 13485, Clause 7.5.6. A defined gate is a hard stop. A unit either passes a documented test against a documented limit, or it does not ship. A failing unit is physically segregated under non-conforming product control, not set aside on a bench to sort out later. When you are qualifying a contract manufacturer for a sealed or bonded device, ask specific questions. Which steps are validated special processes? Where does the leak test sit? Is it 100% or a sampling plan? Is the method validated for this joint? And who has release authority? A field action does not just cost the recall. It costs the launch timeline, the clinical relationships, and in the introducer case, it put patients at risk before anyone quarantined a lot. Every one of those costs is preventable at a gate that costs a fraction of the recall. If you are recovering from a field action or qualifying a new contract manufacturer before your first commercial lot, we will walk your build flow with you and show you where the gate should sit.